From the JAMA Network, this is JAMA Clinical Reviews, interviews and ideas about innovations in medicine, science, and clinical practice. Here's your host.
Hello, and welcome to this JAMA Clinical Reviews podcast. It's my pleasure today to speak with Professor Joseph Blocher from Duke University about this important article that's coming out on JAMA, Guns, Hospitals, and Sensitive Places. I'm Dr. Fred Rivara, Editor-in-Chief of JAMA Network Open. Professor Blocher, can you introduce yourself, please?
Thanks so much for having me on, Dr. Rivara. My name is Joseph Blocher. I teach at Duke Law School, where I am the Senior Associate Dean for Faculty and also co-direct the Center for Firearms Law, which is a center dedicated to broadening and deepening the scholarly discussion about firearms law.
Let's start off with why you decided to write about this issue of firearms in hospitals. You mentioned there were about 240 shootings in hospitals over a 17-year period. Frankly, that doesn't sound that many. There are far more shootings that occur in other public places like schools and churches. So why talk about hospitals?
Yeah, I give a specific answer and a general one. The specific answer here is the credit goes to my fantastic co-authors on this piece. Joshua Romero is at the UNC School of Medicine, Daniel Aaron, an MD, JD, teaches at Utah, and Professor Richard Saver, who teaches at UNC Law School, teaches law and medicine. Among the four of us, we are all personally close, as are I'm sure many people listening here, to gun violence on university campuses or at hospitals. Here at Duke, just 2 years ago, we had a fatal shooting at the Duke University Hospital, a couple hundred yards from where I'm sitting right now. UNC, there was a prominent shooting in 2023 that disrupted my co-author's training. He was at the hospital and had to leave, or my other co-authors had to cancel a class. Dr. Aaron teaches at Utah, where concealed carry is allowed on campus. So we're all very close to the issue. And it's true that in the broad scheme of things of American gun violence, shootings in hospitals may not be the front lines in terms of where the shootings happen. Obviously, it's where so many people are treated. But I think that's all the more reason to focus on regulations that can keep them safe and can hopefully keep the threats down. Now, the 240 shootings over a 16-year period isn't necessarily as much as you might see in other public places. The reports, and we refer to some of this in the article, are that the violence may be getting worse. One of the studies we report between March 2021 and 2022, there's over a 100% increase in nurses reporting that healthcare violence was getting worse. And once violence involves guns, it's intensified, and you're much more likely to see fatalities. So I have to say that data regarding hospital shootings is really hard to come by, which I think just highlights the importance of gathering that data as well as the legal implications of it.
Yes, I know that even our hospitals out here in Seattle, we have problems with the nurses reporting increased level of violence against them, whether it be in the emergency departments or particularly in the psychiatric units. So we're all looking for ways to reduce gun violence. You focus on the issue of hospitals as, quotes, sensitive places, end quotes. Can you explain what does that mean? What do the laws say?
It's really great that you put it in quotes there for listeners. It's a legal term of art. So that phrase, sensitive places, comes from a 2008 Supreme Court decision called District of Columbia versus Heller. And this is where the sort of constitutional law and policy meet in our article. And what the Supreme Court said in Heller was that although there is an individual constitutional right to keep and bear arms, there are certain kinds of restrictions on that right which are consistent with the Constitution. One of them, the court says, is restricting guns in what it calls sensitive places. It didn't say a lot about, well, what are those sensitive places? They say schools, government buildings, but what about other things? What about polling places? What about stadiums? What about bars? What about airplanes? There's lots of places you can imagine might be considered sensitive. And that was a pretty sleepy area of constitutional law for almost 15 years. There were not a lot of litigated cases challenging restrictions on guns in, for example, bars or, for that matter, hospitals. But there are laws on the books. About 20 states have laws restricting guns in hospitals or in other specific healthcare settings. And after the Supreme Court's 2022 decision in a case called Bruin, all that stuff came to the fore, and people started to challenge the constitutionality of restricting guns, including in healthcare settings. And a major case, which we talk about in the article, called Antonyuk, which has worked its way up just to the Supreme Court level so far, involved exactly that. Is it constitutional for a hospital to keep guns off of its premises? Now, I imagine for most medical professionals, that's just a strange question. Of course, that's got to be consistent with the Constitution. But the way the Supreme Court has set up Second Amendment doctrine, it's not enough to say this is good policy or this would save lives of either patients or physicians or other professionals. You have to also show that the restriction is, in the court's words, consistent with historical tradition. And so that's where our article picks up to try to explain why, in our view, hospital-based gun restrictions are consistent with history, and therefore hospitals can constitute sensitive places under the Constitution.
Why don't we take this as an opportunity for you to explain to our listeners this whole issue of historical context that was the center of the Bruen decision, and that might be important going forward. And we'll talk in a minute about the Supreme Court decision that's going to be announced any day now.
Yeah, just as we're recording, it could be coming out in any moment. So what the court decided in this 2022 decision, New York State Rifle and Pistol Association versus Bruen, is that gun laws, in order to be constitutional, have to be more than just good policy. That is, you can't just say, hey, this gun law saves a lot of lives, or that it's very useful in preventing crime. You have to show that it is, again, in the court's word, consistent with historical tradition. Now, that's an unusual test. I mean, the court often looks to history, but it's rare that it asks like questions at that level of specificity when it comes to history. And as you can imagine, it has raised all kinds of problems for all kinds of gun laws, including the one pending before the court right now. And partly that's just because the world has changed so much since 1791, when the Second Amendment was ratified. I mean, current federal law prohibits loaded weapons in aircraft cabins. There's no coherent answer to what James Madison thought about that in 1791. They just didn't have that conception. So there's a lot of analogical reasoning going on in the courts as they attempt to apply this test. And I think that's what will be required for evaluating, again, restrictions on guns in hospitals, which did not exist in their current form in the late 1700s. And so you have to look for analogs, things that were maybe arguably relevantly similar. And again, we go through some of this in our paper, but it is one of the strange distortions of this historically inclined Supreme Court that requires what we lawyers would often refer to as originalist reasoning, even when it comes to something as anachronistic as asking, can you prohibit guns in hospitals? In 1791, there were no hospitals. The standard issue gun was a black powder musket, just a totally different world.
So given this, are metal detectors in hospitals allowed, or are they illegal?
Certainly the framers didn't see those coming either. One of the things that's actually come up in some of these sensitive places cases is that metal detectors, magnetometers, actually are good evidence that a place is sensitive and therefore guns can be prohibited there. Now, how that fits into that originalist reasoning, I think, is very hard to say. To me, anyway, those are evidence that a place is sensitive because it faces a heightened risk of danger or something like that. But you're not going to get there by just looking exactly to the historical record and trying to decide whether almshouses in the late 1700s were similar or not to hospitals. I mean, in our view, the relevant comparison has to do with the populations being served, with the potential heightened risks of danger, and that's what matters, not did hospitals in 1791 prohibit guns.
Has anyone challenged the ability of a hospital to have a metal detector?
Not that I'm aware. Many hospitals don't fall within the purview of the Second Amendment or the Constitution at all. And the Constitution only applies to the government. It only applies to public actors. So a purely private hospital can make these decisions as a matter of policy, and they won't be subject to constitutional challenge. But of course, so many hospitals and other healthcare facilities are public actors, government actors, and therefore are subject to these kinds of rules. And if a state were to pass a law, as again, almost 20 have done, restricting firearms on healthcare premises, then those laws could be challenged and have been, and thus far have been upheld. But as with many other gun laws, I think there's an element of sort of holding one's breath here, which again is why the four of us wanted to write the article now.
And even though many hospitals are private hospitals, not-for-profit, they all take Medicaid and Medicare, and so they still might be under government control in that way.
Exactly. And one of the really hard things here is just getting this is going back to your first question about how do you get your arms around the scope of the problem. Again, data is hard to come by about actual shootings, but I would imagine, in fact, I will just say, there must be so many more incidents that don't actually involve a shooting, but do involve, for example, the brandishing of a gun or just the display of a gun. And that itself doesn't necessarily result in an emergency room visit above and beyond whatever brought people to the hospital in the first place, but it can 100% change the way a physician goes about his or her day or the way that other patients respond. And those kinds of not necessarily shooting-related physical harms, I think also should factor into the calculus, how it distorts the whole workplace.
We are taping this on June 18th, 2024. And your article is published on June 26, 2024. The Supreme Court may have already announced a decision on another important Second Amendment case. Can you tell us about that case and why it's viewed as so important?
Yeah, it's United States versus Rahimi, and it's a challenge to a federal law, 18 U.S.C. 922 G8, which prohibits gun possession by people subject to certain domestic violence restraining orders. The petitioner in that case, Zaki Rahimi, had been found by a judge to present a credible threat to his then intimate partner, and so was prohibited from having a gun. He challenged that restriction as a violation of his Second Amendment rights, and a lower court, the Fifth Circuit Court of Appeals, applying that historical test from Bruin that we talked about earlier, found indeed, there are no analogs in the late 1700s to the modern law that disarms people under domestic violence restraining orders, and you can imagine lots of reasons why that might be. In the late 1700s, women had no right to vote. Domestic violence was not treated with the seriousness that it is today. So the Fifth Circuit struck down this law and said you cannot prohibit people like Zaki Rahimi from possessing guns. The Supreme Court agreed to hear the case. They heard oral argument in November. I believe the government will probably win, and that the court will say something more about how reasoning from history doesn't require finding historical twins. You can find principles in history to guide without looking for specific one-to-one comparators, which again comes back to the argument we're making in this piece about hospitals, right? That the relevant question isn't, did hospitals prohibit guns in 1791, but were guns prohibited in places where there was thought to be heightened danger, or at-risk populations, for example? Schools, for example, maybe it was one of the places where there's a robust history of denying guns. And so if the court in Rahimi says, okay, in 1791, we didn't disarm domestic abusers, but we did disarm other groups thought to be dangerous. Dangerousness is our principle, then that should resolve the Rahimi case and would help, I think, give some guidance on the hospital question as well.
And just for our listeners, one of the reasons that the Rahimi case is so important is that 2/3 of deaths among women, violent homicides among women, are due to domestic violence.
And most of those involve firearms. I'm sorry.
Most of those involve firearms, as I was going to say. So it really has major implications for us as healthcare providers, because we do see those patients in our emergency departments, in our hospitals. We see the children who are oftentimes correlated victims as well of domestic violence. So it really is important. Professor Blocher, before we end up, are there any things you want to mention?
No, again, I just wanted to give credit to my co-authors who really carried the laboring oar here, especially Josh Romero, who's been just absolutely wonderful to work with. And thanks so much for having me on, Dr. Rivara. It was really wonderful to talk about how the Constitution and policy interact or don't in ways that affect us all.
Well, thanks very much. It was great to talk with you. This episode was produced by Shelley Steffens at the JAMA Network. To follow this and other JAMA Network podcasts, please visit us online at jamanetworkaudio.com. Thanks for listening.